that's why I'm still doing it.
Yeah, that's good. And you got such peaceful energy too. It's amazing.
Well, it may appear that way.
Smoke and mirrors.
I've learned my strategies.
There you go.
I always practice.
And that
Never
could be you
stop.
guys. That could be everyone watching this. Look at Lori. She went through it and look how happy and calm she is.
Anyway, thanks for inviting me.
Yeah, thanks for coming.
About Dr. Lori Davis, to our listeners and maybe Joy as well. She's a clinical psychologist and she's an instructor at Cornell Medical College and has a private practice in New York City, where she specializes in anxiety disorders and trauma. And also she has anxiety, so that is interesting. And
One of us.
I'm one of you. I'm part of a very big club.
You're human. You're like us, you know.
Yeah, and
Exactly.
I can tell you, yeah, I know a lot of anxious, a lot of therapists with anxiety, and look, people are anxious all over the world, no matter what the profession is, no matter where they're living. So therapists should certainly be no exception.
And you guys go through a lot of trauma stories, so I mean that's tough.
Yeah, I mean it's part of the job, and you hopefully build up your endurance, over time, or you seek supervision, or you chat with colleagues. But yeah, you take in a lot of information from people, and you have to be smart about taking care of yourself. Setting boundaries for yourself and relaxing after work, because it's a pretty intense job. Yeah.
Yeah, actually wanted to ask if how you build up that protection around you, like because you hear a lot of stories and they are deep as well. So yeah. So let's start with a question like, could you share your journey related to anxiety and how it has influenced your work actually?
Absolutely. So I think I've been anxious for as far back as I can remember, probably grade school. I probably was anxious, but didn't really know what it was. Like often when I treat people or I have friends who are anxious, and they'll say, I never felt quite right. Or when I was away from home too long, I would feel a little bit dizzy, or I'd feel tired. Like I didn't really have a name for it. And I kind of tucked it away. And then in, I would say, very late adolescence, which is a common time for people to get anxious, it sort of kicked up and I had some panic attacks. And that was different, sort of not being able to breathe, heart racing, feeling like I was going to pass out, feeling spacey. I remember having lunch actually with some friends, and all of a sudden it was like a wave of anxiety hit me like from behind. And I just didn't really know what was happening. And I think, one of the things I see often in my practice is, people go to the emergency room. That's one of the first things they do. Something must be wrong medically, right?
Yeah.
So common. You go to the doctor and they do all these tests, and like, you think you're having a heart attack or a stroke, and they tell you everything's fine. And then you're not really sure what's happening. And so I realized over time that I was having panic attacks and anxiety, and I made sure to get into treatment early on. But what I did was also advocate for myself, and I highly encourage people to do this. And I think in both of your pages, you talk a lot about, like you need to learn and read and advocate for yourself. And I did that too. I bought every book I could find on anxiety, and I devoured all of the information. This was before I was a psychologist, and I learned everything I could. And I knew that I needed to get outside the house every day. And I made a promise to myself, however difficult it was, even if I couldn't breathe or was in total panic mode, I was going to step out the front door and like walk around the block, right? Or go meet a friend for 20 minutes. I made that pact because what I had read at the time was you have exposure therapy, right? You need to go and be out in the world. And I think one of the biggest misconceptions about anxiety when people come into treatment is, well, I just avoid all the things that make me anxious, so I'm okay, right? I think, that's how I'm going to get better. And of course, it's the opposite. You need to approach that which you're afraid of so you can habituate, and then
Yeah.
your anxiety comes down and stays down. So I tried to do that on my own, and I did that, however difficult every day was. And little steps turned into big gains over time. And then I was able to kind of do the things I used to like doing, like going to the movies or seeing a show or going to a concert or, again, hanging out with friends. I was able to concentrate more on my work, but it was a very gradual process. And so when I became a psychologist, I had this personal experience. And I don't think that every therapist needs to have every diagnosis to be able to help someone. But I definitely think because I've had this experience, I literally know what it feels like to feel anxious, to be worried about something, to ruminate about it, to worry about going to a party for fear I'm going to like pass out or embarrass myself because I'm so anxious. So I try to use that in my practice. And also when I'm teaching and supervising grad students, like, try to get into the shoes of the person you're treating. You can't always understand everyone's experience, but I think with anxiety, I get it. I totally understand, but one size doesn't fits all. So everyone's different and everyone experiences anxiety differently. So I use the word I recovered, but I feel that there is no cure for anxiety. It's basically you recover to a large degree, and then it's your responsibility to manage it throughout your lifespan, because everyone has triggers, right? Certain people don't do well on planes, or certain people don't do well like when they're off for the summer and they're on holiday. They're like, I don't have any structure, and all of a sudden their anxiety kicks up. Other people don't do well with heights. So anticipating, I'm going to be in a situation that's going to trigger me, and then knowing, here are my strategies to use when I'm in those situations. So I sort of encourage patients to know their triggers. I do that with my own anxiety. So I think there's recovery. I can't say there's never a cure, because there are people who never got anxious and then maybe they're in a car accident, or maybe something happens to them, or they go through a transition in life, and they can kind of go back to their baseline. But for the most part, with most people, they're wired to be anxious. So I think that I try to keep that in mind, so that people come in and say, well, how many sessions until I'm not anxious? And I'm very much a realist and very honest with people. I say, I'm going to teach you everything I know so you can be your own therapist, but you're going to have to manage this throughout your life. And I stick with that. And I think that's helped me a lot in my own recovery, knowing that there are fluctuations.
Yeah, I think everyone has anxiety, but depends how much, that's the case. Like if someone goes to you and asks for help, and he has like 10 out of 10 anxiety,
Yeah.
but that can be reduced, no? Like that can be reduced. Just depends how much. Because everyone has anxiety, but depends how much, I think. So
Exactly. Absolutely. And these misconceptions about anxiety include, like, no one should be anxious. First of all, we are biologically wired to be anxious. We need
that's
it.
even useful sometimes.
Right.
So
We would have been killed. We need to be on alert. We need to know if we're in danger. It could be physical danger. It could be psychological in danger. We don't feel safe around a particular person or in a job. So we need that signal. It's very important. It's just when the alarm bell goes off all the time, then we're getting into kind of anxiety disorders. And then that's when people hopefully come into treatment or start reading books and doing exposure work and so forth.
Yeah, and the part is that a lot of it is how you portray it to yourself. If you're uneducated, you end up start beating yourself up. Like, I thought I was just the weirdest person in the world.
Yeah.
I had to drink like decaf coffee. I was like, what's wrong with me? Why am I drinking decaf? The whole world is drinking regular. And it's just, you got to stop beating yourself up. That's like, I feel like that's 90% of it. It's just the self-hate,
Yeah.
Once you get educated, then you know that, the world, everybody has it, there's nothing wrong with you.
Yeah, I think, Jerry, that's like a huge point, because it's hard enough to deal with the symptoms of anxiety. It's scary, it's unsettling, it can prevent you from meeting your goals in life, being out in the world. But the self-negating talk, what's wrong with me? Why can't I do better? Everyone else is able to do this. I'm flawed. I mean, it's like another thing to grapple with on top of something that's already so difficult to deal with. And I think a lot of recent treatments around self-compassion, like there's a great self-compassion workbook that I have. And I actually have patients sometimes write a self-compassionate letter to themselves. Like, you're doing the best you can. Like, you're learning about your anxiety. You got out of the house today, instead of, well, big deal. Big deal, I made my bed today. Big deal, I went to the corner. Everyone else can do that without blinking an eye. Yes, so I agree. People can be so harsh. And I certainly went through phases like that. Why can't I do better? But I think people will do much better in treatment. And if they're not in treatment, in recovery, if they can, again, reinforce the gains they make instead of criticizing for the things that they're not doing. And I think it's very difficult, though, because people get into these thought loops about themselves. And then the self-esteem gets lowered, and, people don't feel good about themselves. So yeah, self-compassion is so essential to improvement.
Yeah. And what do you think, like, I want to ask, like, what are the common traits for an anxious person who has severe anxiety or panic? Because I just noticed, for example, for me, it's just I'm a perfectionist, a maximalist, plus I'm sensitive, and I just noticed this common traits, which is almost always have the people who have this. Like, what are they?
Yeah, I would agree with that to a large degree. I think that many of the people I treat, well, I think there are a few things. One is, sort of perfectionistic ideals, high expectations for themselves, and feeling like if they don't measure up, something bad will happen, or they're no good, their life isn't going to be the way they turned out. That comes from their own sense of self, but also from messages they internalize from other people, growing up, you should be this, or you shouldn't be that. I think that a lot of the people I work with are people pleasers. I think I see this so much of the time. Maneuvering around other people, right? Keeping the peace, great peacemakers, the great diplomat. Don't speak up for yourself. Don't rock the boat too much. So then you kind of like take in all this energy and you don't speak up, and then you kind of hit a wall because you're not really putting yourself in these situations, and then you don't feel in control. And anxiety is all about control, perceived control or no control. And I teach people to speak up for yourself, put yourself in situations so that you count too. And that's going to make you feel more grounded and more steady. So being a people pleaser is a huge precursor. Yeah, obviously sensitive souls, like everything has a flip side in life. It's great to be an empathic person. It's great to be able to put yourself in other people's shoes. Empathy is a wonderful thing. But I think people who feel things very strongly spend a lot of time kind of feeling things very intensely. And I think that kind of puts you at risk because you're feeling things very strongly. I think people who are, for some reason, learn to be avoidant early on of their feelings, and who feel like it's not okay to connect with their feelings, ultimately hit a wall and sometimes start to get panic attacks. Or people who just aren't honest with themselves about, this is really what works for me in life. Like, they don't give themselves permission to do certain things, and they're not really feeling, again, in control. So there are many reasons why people, get anxious. Obviously, anxiety is a combination of genetics. There's a strong genetic predisposition to all of the anxiety disorders, as there is to depression and some other disorders. But also, again, messages that you got early on from caregivers at school, from friends, from family. It's not to blame other people, but we're all like sponges as kids, and we all take in messages about ourselves.
And then location too, right? New York City is a heavy area of of anger. I don't know how to put that. So
yeah, I think that's true, Jerry. But I've read studies on kind of like where people are more anxious, where people have more PTSD. Some people say that, like, in more educated areas, like, people have the luxury of being more anxious and contemplating all that, because we're not for example, they've done studies of people like who are in war zones. Of course, they're scared and anxious, but they also don't have time to contemplate, gee, I have an anxiety disorder. What should I do about it? So the rates of anxiety are all over the globe. But I think being in certain areas kind of make it, we talk about anxiety more. We talk about PTSD more. I think since certain recent wars, even in New York, 9/11, I think, opened the door to talk about PTSD and trauma. Nobody really knew what it was. It was something that only happened on the battlefield, right? Yeah. And after 9/11 in New York, everyone started talking about trauma. In certain countries where there's been a lot of war, trauma is kind of interwoven in the narrative. But anyone who has PTSD trauma has a lot of anxiety, but it's more a part of the general culture. But yeah, New York is certainly a very stressful place to live, but it's also in some ways a privileged place to live. We have access to certain things, and that other people don't. So it's a mixed bag.
I think it makes us more resilient too. Like we look at other people, and everybody got to keep going. And you can take the subway, and everybody's like determined. So your mindset is like, no, I'm not going to stop. I got to keep figuring this out. Look at all these other people; they're all determined. So I think that's the contagious part of it. Like we grab other people's energy.
Yeah, I mean, a lot of people move to New York because some people think New York. I'm not saying this is true. Some people think that New York is the center of the universe, right? That's it. You have to be in New York. So people come from all over the world to be in New York. And so, yeah, there is a culture of achievement and setting goals for yourself, and you can live a better life and you can accomplish more. And yeah, there is an energy that feeds on itself. It also can cause a lot of anxiety, as you're saying, because it's so competitive, people are always doing this sort of comparison shopping with other people. And that's one of the reasons why social media is really a mixed bag in terms of anxiety. Comparing yourself to others, who has more likes, who looks better, whose life looks more exciting. And so there's the same kind of energy, right? Always like looking and comparing. And I have people coming into treatment like, I was on Facebook or Instagram, and what's wrong with my life? I don't, my life, I don't have a carousel of photos like traveling the globe and like eating all this great food all the time, or have all these degrees. So it's interesting.
Yeah, I remember I was in a New Year's Eve party in New York, and there was a bunch of girls all lounging out, looking so boring, playing with their phones. And then when it was time to take a photo, they put on this amazing, energized performance.
Right.
And that's what people see. It's like they're having a blast all the time. It's all smoke and mirrors,
It's a lot of smoke and mirrors. But people who don't have a good sense of self, or this self-esteem is a little low, like they really believe that to be the case. Yeah. And I always say to patients, I understand how you feel, but I can tell you as a clinical psychologist that I hear what goes on behind the scenes, and you're seeing a very small layer of what people's lives are really like. They're like, really? I'm like, yeah, really. Just like they think therapists have no problems or no anxiety. Yeah.
Social media. So how can others handle that properly then? Like, they should delete it?
Yeah, I mean, that's a tough one. I had a session with someone yesterday. I can't give you more details, obviously, but this whole issue came up about Twitter, and it was causing anxiety. And with everything that's going on in the world, whether it's war, natural disasters, politics, global warming, I mean, we can go on. And then just looking at what people are wearing and, who's funnier and whatever, it was causing this person anxiety. And so we talked about scaling it down. Like, I don't think it's realistic to say, okay, quit Twitter, quit Instagram, quit Facebook. Like, people want to be connected. I think connection is a really good thing. It's bringing the world together. But I think you need to do it in small doses. So I often tell people, okay, let's carve out a couple of times during the day. You can't go on social media. And I want you to verbally contract. Like, I'll check the news in the morning and check my social media. And then the next 3 hours, I'm not going to go near it. I'm going to focus on my work or something else, or I'm going to actually see my friends, and then I'll return to it later. And I think if people can commit to that, they can learn that they actually have a sense of control over it. because it reaches a point now, we have this like social media anxiety disorder now. It's like people are so attached that they're starting to get actually anxious symptoms if they're away from their phones for more than a few hours.
Yep.
And they can be in
Addiction.
conversation
Yeah.
with someone else, like, or on a date, and they're like constantly checking their phones to check on their social media. So it's pulling them out of the moment. People aren't being present focused anymore. So I think there are ways you can slowly approach finding that balance without having to say, I quit, because that rarely works. You know, just deleting the app, invariably you're going to come back to it. And when there are big news stories that affect a person's region or the whole world, people want to see what's going on. So just, you know, contract it either with a therapist or with a friend or a family member. Today, I'm only going to be on, you know, Twitter and Instagram 2 hours, which is still a lot, but it's better than, you know, 4.
22 hours.
That's a beginning. And because it starts to regulate your nervous system too, you know, sort of you get these dopamine hits when you check your own account and you get these likes
Yeah.
or looking at your page.
Reels, everything.
And it's like gambling. It's like going to the casino. You're getting variable reinforcement, which means you go on and you're like, all right, who likes me? Who doesn't like me? And then if you get a like, you want to go on the site more. And then if you don't, it impacts your mood. So it's wreaking havoc with your whole nervous system, which is hugely problematic, particularly in people who are prone to, you know, anxiety in the first place.
I'm hooked. I'm hooked. I started this healing page a few months ago with hers, and I do the same thing. And sometimes I do it to numb out any kind of, like, if I have a bad dream at night, I wake up in the morning, and to get rid of it, I look at my phone, and I use that as numbing.
strategy. Yeah.
What does it do? What does it do for you? So
It's like drinking alcohol for people. It numbs it, and you don't have to think about it. And my wife gets mad, and she's like, "Give me the phone, put it by the window," because I'll be like 3 a.m. if I have a bad dream, and I'll grab my phone just so I don't have to experience the feeling of that bad dream.
yeah, I mean, it does work temporarily. The thing about the phone in the middle of the night is
Yeah.
that then it messes up your sleep. So I have a lot of patients who come in and they're like, I didn't sleep well. I'm like, well, what time did you stop looking at your phone last night? They're like, oh, like 10:30. But then I woke up at like 2 and I'm like, did you get on the phone and look? And they're like, well, I really tried not to, but I only looked for a few minutes. So there's the blue light, like there's just physiologically, you're messing with your sleep cycle. And then your brain starts thinking about all the stuff that you're reading. And then people don't turn off enough. And that's actually, poor sleep is not helpful for anxiety. It's not helpful for depression. It's not helpful for anyone to be able to focus at work or whatever you need to do. So, yeah. So this social media is a mixed bag. Again, I think it's great that you guys have your YouTubes and your pages. And I've been doing my page for just about a year now. And I've met some incredible people. And it's also been good for me personally, like connecting with people around the world who have anxiety or other issues, being able to talk about it and being able to be honest, even as a psychologist saying, I have anxiety too. Like, I think it's enormously helpful for all of us to talk about it. So like, I would hate for that to stop. It just has to be, you know, done in a reasonable.
Balanced out, yeah.
Yeah. And
It gives relief to know that you have anxiety too. It gives relief.
yes.
We are just human as well. And
Right.
That's-
So
that's
Urs,
good.
what you know, reading your posts, you're always talking about exposure. You have to, right? You have to slowly approach. And I think I see people following you, and that gets through. People do listen, and you being able to say, look, I went through this for a few years, and look where I am now. That's so helpful to hear. It's so comforting, and it's also motivating and energizing for people. And that's so hearing you know, write or speak is different than reading something in a book, right? You're reading a textbook about anxiety. That's all really helpful. But seeing a real face and a sort of an empathic person being honest about it, that's so curative. I think that's really helpful.
yeah, it has the power. Yeah.
It does.
Actually, I recorded today 2 reels about exposure therapy, like how to make it more gradual, and some tricks about that. So related to this, I want to ask, like, okay, exposure helps. What are the other techniques or the other things which helps in this?
That's a excellent question. I think there are different camps of people who believe different things about anxiety. I have had myself different kinds of therapy. I'm a cognitive behavioral therapist. So when people come to me to talk about anxiety, we talk about thought patterns around anxiety, like I'm never going to be a calm person, or these things make me anxious because, and sometimes there are faulty thought patterns. And then there's the behavioral piece, getting people out of the house and committing to doing activities that are going to approach their anxiety. So there's that place. I've become more integrative in my work. So I believe that whatever works is good. So I do mindfulness exercises with patients. I also try to practice what I preach. Everything that I ask patients to do and everything I talk about on Instagram, I try myself. Because not everything, and also not every strategy works for every person. So mindfulness, I do a lot of visualization exercises when you're really anxious, doing a split screen where you're really anxious here, and then you see yourself like on the beach, sitting there quietly, feeling really calm, seeing the sky, the calm water. That's a split screen approach. Visualizing a safe place. So I think self-compassion also, as I mentioned earlier, being nicer to yourself, so that through your recovery, you are being your own cheerleader, and that you are being nice to yourself as you move forward. Also, traditional therapy, talk therapy. It certainly helps to have someone bear witness to your life story, to the issues that are bothering you, to trauma, things that happen to you. It's very powerful to have someone sit with you and be there for you consistently. It's very, very strong element of, I think, recovery. So I think I put all of them together. I have colleagues who do EMDR for anxiety. I know people who go to hypnotherapy. I've tried that myself. Again, I try to try everything before I talk about it. So there's virtual reality stuff now. I mean, there are so many modalities. There's somatic re-experiencing stuff that, for trauma, which can reduce anxiety by connecting with trauma and past events that reside in the body. Big proponent of that. But I think that anyone who says this is the only thing that works, I think is not realistic. In the end, though, I'm going to go back to exposure. If you don't, you can do all of the other things, but if you don't get out there and do exposure work, you're not going to get to the same place. That's my personal and professional stance. You have to be approaching. If you're afraid of dogs, you need to approach. If you get into a car accident, you need to get back in the car. If I had this thing for a while. I couldn't sit in the middle of an aisle in a show or a movie theater. Now you could say, well, you could live with that. Sure, I could live with that, but I didn't like it. So I did exposure therapy little by little. I started on the aisle and slowly I moved in. Wow. I can go to a movie now and sit in the middle. So I'm a firm believer that is what works, because in a way we are like laboratory rats, right? It's all about conditioning. We get conditioned that things are scary and are threatening. And unless you reapproach, your anxiety is not going to come down and stay down. So I'm like a broken record about that.
So Dr. Lori, all three of us have had the want to get rid of it. Like Urs and me, we wanted to get rid of it so badly. Like sure. I'm a nut for researching myself. He is the same way. What makes us different from others who I'll start next week. I'll just deal with the anxiety. I don't know. Why is it so overwhelming for other people to dive in completely and get the research out of it and understand it?
Well, I think there are different reasons for that. I think motivation about certain things in life, I know that some of my personal goals required me to be literally out in the world, right? I had to do certain things to meet my goals. And so I think motivation is so important in life. I think there are other people who they can do things from home. Well, now I could work from home, but I mean, there are certain people who can stay at home and don't have to be out in the world, so they don't approach things in the same way. I think that avoidance is a big and powerful reason. Denial is a big and powerful reason why certain people I'm very careful about what I'm saying right now because I don't believe in blaming the victim, blaming people for not being able to do certain things. Because I know, like, I can't always do everything in life that I'd like to be doing. Sometimes fear gets in the way or other things get in the way. So I want to be careful about how I say this. But I think that people in life have to do things in their own time. And there are people I've treated who have been anxious for 30 years and never went into treatment. And when they finally come into treatment and say, wow, I can do this, I can actually recover and feel better, then they lament, why did I wait so long? Like, I lost all that time, all those years, or my childhood, like I didn't meet goals in life because of my anxiety. So I think internal motivation is one of the reasons. Certain people just have that drive, like, if I don't get better, I'm not going to be able to live my life the way I want to, and I can't live with myself. So I think these sort of perfectionistic ideals, like, I need to be able to do this in life, so therefore I need to recover. But I think people are frightened. Anxiety is scary. Life can be scary. And I think that it takes people sometimes decades before they can really reach out, despite relatives. Like, people write to me, I have a cousin, or I have, like, my best friend won't go into treatment. What should I do? I keep giving them names for referrals. I keep telling them books to read, podcasts to watch. They're so stubborn, they won't do it. And I say, you can't do this for someone else. They have to find the motivation and the courage. And it doesn't mean that people are anxious or weak. They're not. But it takes courage to be able to take those first few steps. I've done phone sessions with people where they couldn't get out of the house. And I said, that's okay. Like, we'll do the first session. This is before the pandemic, before everything went virtual. I'm like, we'll do a few sessions on the phone. Let's just talk. And then finally, like with certain patients, one patient was able to open the front door and just go out in the hallway in her apartment building. She didn't think she could do it. So belief in yourself is so huge. And some people just were not raised to believe in themselves, right? They didn't have that confidence. So I think self-belief is hugely important in who then kind of reaches out for help and recovery. And other people are embarrassed. They've been socialized. You're weak, you're anxious. Don't talk to a stranger about it. Don't seek help. You should be able to figure it out, especially males. Chin up, like, you're socialized to be a tough person. You don't get anxious. That's all made up. So they don't come into treatment either, right?
Yeah.
So you see there are so many reasons why.
Yeah, I think also the mindset is the mindset. Like, they start with the mindset like, I want a quick solution, and they just go for medication, only just medication.
Yes.
And they just get lost, and that's the other, I think, the other bad way. And so related to this, what do you think about medication? Like, when should someone start with that, or when should they take it, or how is that?
I think it's a tough question. What I've learned over time is that there's a place for medication. I'm very middle of the road about medication. I think that for anxiety, therapy and exposure work take time, though. And there are certain people who are so anxious, they have to go to work, they have to pay their bills, they can't do what they need to do. And if someone can't get out of bed, can't get out of the house, can't meet their responsibilities, can't take care of their kids, can't mobilize to do basic things in life, then that may be the time to say, maybe you need a consultation for medication. Now, that gets into what kind of medication for anxiety. I'm a clinical psychologist, not a psychiatrist. I work closely with colleagues. So if a patient is contemplating medication, I will send them for a consultation and we all talk about it together. If someone can't mobilize, if they can't function, if they're suicidal because of those symptoms, you talk about next steps and I send them for consultation. Now, a lot of people ask, well, if I take an anti-anxiety or an antidepressant, is that going to mask all of my symptoms and then I'm not going to get better? And I say, it depends on the situation. If you take medication because you need to or you want to, you have to continue to do the work. You have to come to therapy. You have to keep reading. You have to do exposure work. You need to exercise. That helps anxiety. You need to move forward. The medication doesn't cure your anxiety. It's basically tamping down some of your symptoms. So a lot of, as you said, a lot of patients will take something and say, okay, I'm fine now. I have medication and I'm not panicking. So, okay, I'm good to go. And then they forget about everything else until maybe a life event happens and the anxiety gets kicked up again. So I'm very clear on, you need to do a combination of things. People ask a lot about Klonopin, about Xanax, the benzodiazepines, and they're scared. They work very quickly, they work effectively, but then there's the whole issue of dependency. They get dependent upon them, and it's very tough to get someone off that medication. Some of my patients will take some benzos while they are on Zoloft in the beginning, just to quell some of the symptoms until the antidepressant kicks in. So I think there's a place for medication. I'm certainly not anti-medication at all. It can work really, really well, but not if the person isn't focusing on, why did this start in the first place? What is the origin of this? What life issues are you really grappling with? How are you dealing with your stressors? What are your coping strategies? Are you eating well? Are you exercising? Are you getting out of the house? So that's my stance, I think, on medication.
Yeah, maybe that's the issue. The issue is when it's just taking medication and nothing else. That's the...
Yeah, and studies actually continue to support that it's the combination of therapy and that kind of work with medication that shows the best outcome in terms of anxiety and depression. So taking just the medication without the therapy, you don't have the best outcome actually anyway. And plus the other thing about, some of the medications is, which I think isn't spoken about a lot, is people prone to anxiety often have some of the side effects in the beginning of taking an antidepressant. They get sort of a kick up in anxiety in the beginning, or they don't sleep so well, or the lights seem too bright, or they feel overactivated. And over time they can acclimate, but they get nervous in the beginning. They're like, I'm feeling actually more anxious before, but because it takes a while, it takes 4 to 6 weeks really for an antidepressant to really kick in. Whereas something like Klonopin or Xanax, boom, it works right away, but it's not good for the long haul.
That's interesting. I never heard about that, to be honest.
Yeah.
I always enjoyed the pain of it. I always enjoy sitting in my own pain, swimming in it. Like,
how do you do that?
Yeah, I don't know. I think Urs is the same way. I just enjoyed the addiction of being in the pain, having my back against the wall. And then I got the sensation, like, when you have your homework and it's due, your term paper is due, and tomorrow it's due.
Yeah.
I've done that all my life. My mom.
Urgency. Yeah.
When you're like, uh-oh, now I have to do it.
Yeah,
so
yeah.
That's an interesting analogy about anxiety. Look, that's a big thing now, just accepting your feelings. And look, I'm a bad meditator. Like, I've been trying for years, but a lot of it is let the pain, let the thoughts, let the feelings flow in and flow out. Like, now, like, it's really, like, yoga works really well for me because I'm in that zone, but I'm moving. Like, I need to be moving. It's hard for me to kind of just sit, but that's impressive that you can do that. Because
that's how I grew up. My mom always made me do everything last minute with the homework papers, and I noticed that my like the tunnel brightened up in my head. Like, I knew exactly what to do then when my back was against the wall, and I said, I can't numb this. I'm like, this is when I get motivated.
Wow. Well, the symptoms can be so uncomfortable, though. That's the thing. Like, I can say to patients, like, yeah, I really know what it's like to feel a panic attack. Like, when you really want to, when you want to crawl out of your skin because your heart's racing, or your stomach hurts, or you can't concentrate, or you're sweating. Like, it's a tough state, to be in. In the beginning, when people don't know what's anxiety, like, I'm dying, like something really is wrong. I'm going to die right now. So that's.
And still after they feel the same. So,
yes. Yeah.
That's the interesting part. Like, you know that you won't die, but you feel the symptoms anyway. Like. And
you won't. You won't. People still ask me, "Am I going?"
Yeah, no one died from a panic.
No. And I don't know if you remember, but when the TV show Sopranos came out, Urs, I don't know if you saw that. Joey, did you see Sopranos?
I'm a bad Italian. I don't really watch a lot of
That's
mafia.
The
I don't
point
watch
is,
a lot of mafia.
the reason I'm bringing it up is Tony Soprano had panic attacks,
Oh,
and
okay.
he was in therapy on the show. So he would have these panic attacks, and then he'd pass out. So my patients were like, "Oh no, am I going to start fainting?" The fact is, no, you won't. You're not going to pass out for anxiety. It's very rare. But people saw that on TV, and it was a hugely popular show. Or if they see it in movies, people having panic fainting, they're like, I'm going to be like at work and I'm going to pass out and embarrass myself, or, you know, what's going to happen to me. And that they sort of exaggerated that, you know, for dramatic effect on that show. And everybody was like, oh no, you know, it's going to happen to me. But yeah, you won't die from it. But look, people lose their appetites. They're so anxious, or, you know, sleep is poor. So, you know, I'm trying to read more about sort of health outcomes, like what happens when you're anxious for so many years. Like, are there negative health outcomes? And you know, I'm not an expert in that, but I'm curious about that.
Well, they say the body is not at ease. Dis-ease is when the body's always not at ease, and
Right.
your immune system drops.
That's what people say. And with anxiety, your cortisol levels are going, you know, and especially in the morning, you know, studies show that cortisol levels, which is a stress hormone, kicks up in the morning. So a lot of people I ask people, when are you most anxious? A lot of people say, when I wake up in the morning. I'm like, zzz, you know, my thoughts are racing. It's because actually is a physiological reason in the morning. Your stress hormones are higher.
Mm.
So, you know, there is some kind of science behind some of this. Yeah.
And the worst thing is the whole thing is a downward spiral, because you cannot sleep because of the anxiety. Then you are more anxious because you cannot sleep. And it just goes down, down, down. And it's very hard to come out of that. It's just very bad.
Yes.
Even if I took, they said I should take, what is that, melatonin. I just noticed that it didn't help because my brain was fired. It was fried, and my thoughts just went. And it's just, I couldn't sleep. It didn't help that much, to be honest.
That didn't help me either. There are some studies about on lavender the last several years, maybe having a mild anti-anxiety effect on certain people, but I don't know that it's as significant.
Yeah, it's not that. Yeah, it doesn't have that much. If you have a little anxiety, then yes, but if you have panics,
not when you're up to here.
Yeah.
And I think that's a lot of. One thing that I've learned a lot about my own anxiety and also patients' anxiety, and I tell people this: your anxiety is going to get elevated, right? I use the 0 to 10 scale or the 0 to 100 scale with patients. Some people like the 0 to 10 because it's smaller, but you want to use your coping strategies all the time, and you want to really use your strategies when you're in the moderate level. People wait until they're like 8, 9 or 10 or an 80 or 90 when the anxiety is so high. It takes longer than to bring it down, and then people are exhausted, right? When the anxiety gets so high, people are like, I'm so tired now. I just I want to go to sleep. So learning when to knowing your triggers and knowing what your coping strategies are. I always ask people, what are your coping strategies? They're like, I don't know. I go have a drink. I'm like, okay, well, what else? I listen to music. I'm like, music is great. If music relaxes you, that's a wonderful thing. Other people meditate. Other people walk. Silent walking is a big thing right now. Don't put your headphones on. Just walk. You walk in a park or through a forest, and don't have all that stimulus like social media or too much loud music or whatever. So know what your triggers are and know what your coping strategies, so you don't get to that point. Then if you try to go to sleep at night, like you're saying, melatonin, other things they're not going to bring your anxiety down. You're already too activated at that time.
Yeah. For me, it was a big one was exercise, and that helps a lot. Like
what did you
training, lifting weights, running helps a lot. And the exercise helped a lot. I had a bad stage where I couldn't even go to the gym because my heart rate went up and I just panicked. That was the worst.
So how did you
cannot even use that?
back to the gym? You just kind of went in the front door, then left, or went for 5 minutes, or like how did you do that?
I had to take some rest, like 1-2 weeks, because I think maybe I overtrained as well myself, because I went 7 days a week, like I was a maniac. Because I used that to cope with anxiety, and I just
Where
it
exercise
felt
is
good.
amazing.
It felt good.
Exercise brings it all down. Like it really.
Yes, and even nowadays I use that as a coping strategy. But it's a good one because it's not unhealthy. It's not like drinking, and also
Yeah.
it helps to express your emotions, like release the tension. Because if you go to drink, besides that is unhealthy, you are not releasing the tension. You're just suppressing it.
You're
I
just
think
numbing.
that's
Yeah. You're just numbing. That's
that's
why
the
writing is a really great strategy too. Like if I get really anxious, I turn my phone on. I talk to Siri and I go blah blah blah. I'm really anxious because I had a really crazy day at work. I have too much on my plate, too many things to do this week, blah blah blah. And I just sort of like get it all out, and I talk into the microphone, or I always tell patients to do this. Take out a piece of paper and write everything that's in your head that you're anxious about. It takes about 2 minutes, and boom, it's out of your head and it's on paper. And then the anxiety comes down because we hold all this stuff in. That's why exercise is so great, because like you get your heart rate up in a good way, and then you burn off that energy. But not many things give you that kind of quick relief like that.
Yes. Yeah, because if you say to someone who has a big anxiety to sit still and meditate, maybe it's not the best advice, because maybe exercise is a better advice to start with.
Because you're right, you're moving, and people,
you occupying your mind, you get in the flow easier, I guess. So
Plus, you're getting angry at the anxiety, like punching a bag. That's a representation of like, I'm not going to let you win. So I think there's a thing there where it's like, you're not going to get the best of me. I'm going to beat you, kind of like.
That's good. Using anger and energy, right? Anxiety is kind of like, they're pros and cons. Anxiety is sort of the enemy. You're not going to get the better of me.
Yeah, mind shifting technique type of thing, I guess.
That's interesting. But then you also have to make friends with your anxiety, right? You get mad at it and battle it, but then you also have to make friends with it. Like, you're a part of me, but not the whole of me. And like, I know you're a part of my life. And
I love you.
You're a companion. I wouldn't go that far. And I don't like it. I don't like it. No, I know what you're saying. But like, I have to live with you. Like, we have to coexist. So the best I can do is I'm going to accept you for now. Acceptance. Like, you're a part of my life for now, or something.
So when a person gets a panic attack, like, can you give like the rundown right away? Like you said, you record it and you talked about being its friend. Like, what's like in the first few moments of their panic attack, they're inexperienced about how to do it. Like, you basically see the panic attack as nothing dangerous. You welcome it in. You kind of talk about it, talk it through, kind of keep yourself grounded in the moment, which writing does. You keep yourself in the moment, because the minute you don't stay grounded, you're going to be in the washing machine with that stuff.
Exactly. So I think that's why strategies are so important. And whether you do this with a therapist or you do this on your own, writing down your strategies. Like, so for me, sometimes it's like, I label it. Okay, my heart's racing right now. I think I'm starting to get really anxious. I go, am I justified in being anxious right now? Like, what's the threat? This is key. What's the threat? Well, I might screw up this interview, or I'm going to get fired, or I'm going to be out with friends I won't have anything to say, or I don't have enough money to pay the rent, or I'm afraid of getting COVID. Like, whatever it is, identify the threat and then ask yourself in that moment, is this a real threat right now? Because sometimes the anxiety just starts kicking off again and again. So I sort of identify the feeling, identify the threat, and then I go right into my coping strategy. So I know what works best for me. So for me, I have a yoga mat, and I sometimes just do like, I'll do plank for 60 seconds, which is a good thing to do anyway. But like, it's like, that's mini exercise. Like, if I'm working, I don't have a lot of time. I can't run out to the gym. So I might do a plank, or I might do sort of like some core work. because then I get my heart rate up in a good way. It burns off some energy. That's something I do. Other people get on the phone and like call a family member, right, or a friend. I'm really panicking right now. And I think the main thing is to acknowledge what you're feeling and then, as you said, Joey, shift away from it. Like focus on someone else, right? I'm calling you because I'm anxious. Tell me about your day right now. Tell me something funny that happened. So everybody has different strategies that they can use when they're in the middle of a panic attack. And yes, you're right. Knowing that you're not going to die from it and reminding yourself, I've been anxious hundreds of times in my life, maybe even thousands, and I always get through it. I try to visualize a place where I've gotten through that tunnel and I'm no longer panicking, right? So like I'm really anxious right now, but later today, I'll probably be calmer. So visualizing a positive outcome. So both of you, there are so many different strategies you've learned for yourself and probably for others that work. I've done the same for myself and I do the same thing with patients. Someone can go to and listen to music for 2 hours and it just brings them right down to baseline where they're panicking. Music is great. Like I love music. That doesn't really work for me. I have to be moving. Like I always tell other people, I'll say, go clean out the closet now. Like you're panicking. You go from an emotional moment, do something concrete. Go reorganize your sock drawer or, clean out the kitchen cabinets. Nobody really wants to do that, but those things work. So I think people have to be really honest about what works when they're in the moment of panic, because it happens sometimes so quickly, like a wave coming over you. You're fine, and then all of a sudden you're in that moment. So you have to have your strategies at the ready. You have to know them, right? And it's the same thing with the exposure work. You need a plan, right? This is what I'm doing this week for myself. I've been having panic attacks or I have agoraphobia. Here's my plan for this week, and I'm going to stick to it no matter what. So having a literal structure, write it down, put it on your phone, and know you're going to do it no matter what. It will give you some little sense of control when you may be feeling very dysregulated and very panicky and scared. So there's so many different things that people can learn. Also support. One of the things I think that we were going to talk about is, where do you get support, and how do you get support from friends, family, loved ones, people at work? Who do you tell? I think it's complicated because people are afraid to share that they're anxious. They're worried that people will look negatively upon them.
Yes, because it's hard to be honest, as you said. Like, if you have the anxiety, and because you are not that honest, you are afraid to show your real face. Basically, that creates tension, of course, and then it's hard. Therefore, it's hard to ask for help because you just don't want to show it, and that's maybe the reason to start with. So it's a big cycle, like
especially us men. We can't look weak. I grew up with my parents, like they work their hands every day, and my mom pulls a hot potato out of a pot. And it's like to show her that I'm anxiety, like what the, so I kept it to myself and I just worked on it by myself.
Very right. I think there is, I hate to make gender generalizations, but I think there is one about anxiety and other mental health symptoms. Like even in New York, like I worked on a 9/11 program and the men came in much later for treatment because the men were much more apt to deal with it themselves if they had symptoms of anxiety or PTSD, where they go out with their friends and have drinks right after work, and that's how they like bonded and dealt with the stress. And then until someone in the family, like a partner or like a friend, was like, you need to get help for this. Like you're being angry a lot of time, or you're anxious and you're not functioning and you're just not yourself anymore. And then they get dragged into treatment. So I think men do have this extra piece of like, I'm supposed to be handling all of this, and I'm socialized to be, strong person and, quote, not be weak. So I think it is such a big challenge to share then with a partner. I think one of the things I've learned through being a psychologist is when people finally get the courage to share with a partner, with a friend, with a work colleague, I'm having anxiety. A lot of people come out of the woodwork and say, I've been having anxiety too. Or like I had anxiety, when I got a divorce or when I moved, or when I got sick or whatever it is. And that so many people have anxiety that people more often than not are going to be very supportive. But you also need to know if you have positive social support around you. People who are going to go, there's no such thing as anxiety, or just like close your eyes and, you know, it'll go away. Like, those are not the people you may want to be around during, you know, going through a very difficult phase of anxiety. I always say, go where the love is, go where the love and support is. Like, negative social support actually has negative outcomes for people health-wise. Like, it's not, you're better off being alone than having negative social support.
Yeah.
But I think more often than not, when people share with someone, they usually get a positive response. Not always. But
I grew up in a family with everybody didn't show emotions, my whole family. So
yeah.
a lot of that is the influence, like, okay, I mean, my family doesn't show like emotions. I'm not supposed to show emotions. So I think subconsciously that kicks in for the person, like, no,
sure.
I have to ignore it. I mean, this is what I grew up with. This is what I know. I have to ignore the emotions. We don't talk about emotions, you know.
So is that better now? Have you learned to?
You know, I've been the odd one out where I love showing emotions. Like, I could hug my wife 15 times a day.
And I'm sure she loves that.
How it happened, but yeah.
I'm sure she loves the fact that you're connected to your feelings, and that again, that's going to help you with your anxiety. Because also you hug her, you're having a moment of connection, which is always soothing and comforting.
Yeah.
So.
Yes, even your brain just releases the chemicals, the good chemicals. So.
Yeah, oxytocin, man. You know, same thing with pets. I'm a big animal lover, so I have pets, and that's another strategy. I'm feeling really panicky. I just like snuggle with my pets, or I play with them, or because they're just like loving creatures, and they're also, it's tactile, they're fluffy, like it feels nice to just be around them.
I'm dealing with two right now.
Oh, Frenchie.
Yeah, they're both play fighting, and I'm trying to stop them because the one guy had hematoma in his ear, and he's got one ear deflated now.
Oh, I had that with one of my pets. Yeah.
Yeah, so I don't want them play fighting because it costs me money.
They are so cute. I had a pug years ago.
Really?
They're similar temperaments. Oh my God, so cute. Yeah, so animals are so good for anxiety.
Yeah.
Yeah, they have good energy and it helps a lot. And they accept you. That's the other thing. They cannot judge you.
Right, unconditional positive regard. What's better than that? That's what therapy is supposed to be about too. Someone who's going to sit with you no matter what's going on, hold you in high esteem, and be there for you. And studies do show that is the most curative thing about therapy. Whatever techniques you use, studies show that's the most important thing. Goodness of fit, how you get along with the therapist, and someone just sitting with you and being with you when you're not feeling great and you're working through things.
Yeah. Has your lifestyle changed? Like, do you minimize coffee? Like, what do you kind of teach your clients as far as, like, what is their lifestyle? Like you said about the Twitter, he's always on Twitter, which is creating anxiousness. So is food a big part of it? If they consume too much sugar or too much coffee?
Yeah. I think that's something I always talk about every session with patients, and certainly something I've done for myself. So in terms of caffeine, look, there are certain people who can have 5 cups of coffee and like they don't feel anything. Some of that is biology. For myself, I limit it to I have a half of a cup in the morning, and that gives me just enough zzz, which I probably shouldn't have, but I need a little bit. And then I don't have a full cup. Like, that's it for me for caffeine. I think diet is very important. A lot of times when people start getting panicky, they lose their appetites because their stomach, they have stomach aches, everything, everything tightens up, your gut, chest, your throat. Like, so a lot of people are not eating, they lose weight in the beginning. Obviously, there's another, like some people get anxious and they eat a lot and they gain weight, but a lot of people lose their appetite. And so I check in with them, like, did you make sure to actually put some decent food in your body today? Because otherwise you're running on fumes. You're running on no energy. It doesn't help anxiety. So food, alcohol comes up a lot. Like, what about drinking? I I think everything in moderation, but there are people who report having like a lot of red wine. The next day they feel anxious. I don't know the science behind that. I have no idea. Alcohol is also depressant. So, and we know that when anxiety and depression often go hand in hand. When someone gets to a certain level of anxiety, they start to worry about the anxiety. They start to get down on themselves, and it impacts their life, and their mood starts to drop. Similarly, when people are going through a depression, they start to worry. I'm so depressed, I can't do anything, and then they start to get worried. So often they go hand in hand. So alcohol is a depressant. So you want to have a drink or so with your friends, have fun. That's good for you. But to use that as a way to cope, you're really just kind of messing with your, with your physiology. So I don't recommend that to any large degree. People always ask me about CBD now, or weed, is that going to help with anxiety? So everybody's different. Everybody's different in terms of what helps. So lifestyle, it's really like anything else, a balanced lifestyle. Diet, exercise, sleep is so important. People don't sleep because they're worried. That's going to kick up your anxiety. And then also, as was mentioned earlier, then you're starting to worry that you're not sleeping. And then if you don't sleep, are you going to function? Are you going to do well at work? What's going to happen? So, and any balanced lifestyle, and also more than anything else, be out in the world. Get out of the house, even if it's for 10 or 15 minutes. Get some fresh air, be out among people, even if that's a trigger for you. Just force yourself to go out every day. So all of these things.
Yeah, and out of your head, right? Because if you're sitting home, you're thinking too much, and that's
you're gonna ruminate, and you're gonna be in these thought and worry loops by yourself, and that's not conducive to recovery.
So when I was a waiter at Cipriani's on Grand Central, and then I got my panic attack, and I said, you know what, I'm gonna go back. And I went back when my panic was heavy, and I was actually a catering hall waiter with like 150 people there, and I would get them while I was walking with a tray in my hand, and there was nothing I can do about it. And the noises, I had hypoacusis too, so the noises of the plates, but I threw myself in completely.
Good for you. Amazing.
Yeah, I didn't care. I was like heavy duty with it. I was getting panic attacks while I was serving people. Like I said, I don't know what it is. I just love the pain part. I don't know what it is. It just gets me excited, I guess. But I just died right in.
Well, what you did was what one needs to do. The downside or one caveat about exposure is not getting flooded. And so sometimes when people read about exposure, right, they're like, okay, I'm going to do all of this week. And then the brain gets flooded, right? And then you're like an anxiety warrior, right? And if you get too flooded again, you're going to get overwhelmed. You want to go, it's sort of, gradual exposure. You do a little bit at a time, and then you add to it. And then you do a little bit more, and then you add to it. And
it's like the gym. Like you train a little bit, but not that much.
Exactly. Right. Like you're going to go to the gym 7 days in a row and like a mad person, then, you're going to pay the price.
Don't be a daredevil like me.
Yeah, and it's the same thing with exposure. People are like, but that's not fast enough for me. I want to get better quicker. I'm like, but you also have to do it smartly. If you push yourself too much, if it's, too many hours, you're going to be exhausted. You're actually stressing your nervous system too much. Go slow, but do it frequently. Small paces, but the intensity can be low, but the frequency has to be there every day. I say, or you could take 1 or 2 days a week off. People have busy lives. I say at least 4 times a week, you should be approaching your triggers. And then you add to it.
How can you find the right amount or a right intensity? We just talked about that with Joy, like how you find the balance, like you push enough, but not that much.
Yeah, so there's a good way to do that. Again, I mostly use the 0 to 100 scale. 100 is the most you can imagine being anxious. 50 is moderate. 80 is really high. 30 is mild. You can also, again, some people use the 0 to 10 scale. So I often tell people that when you do exposure work in the beginning, your anxiety is going to go to like a 9 or a 10 or a 90 or 100, right? Like, because you're starting out the program. But after a while, you don't want to keep yourself at a 90 or 100 all the time. So make a hierarchy. This is the best way to manage what you're asking. You make a hierarchy. So take out a piece of paper or do it on your phone or whatever, or your computer, and write down your anxiety triggers, like going into the supermarket or going to a concert or social events or a work presentation, whatever it is, whatever your triggers are. And then ask yourself, okay, now I have my list of 10 triggers, right, for anxiety. I'm going to give each one a number. So going to a concert, I'm going to give that a 7 or 7B. Going to the supermarket, that's like a 95, right? So then you take the 10 items and you put them in order. And that's how you do your anxiety treatment. You start at the bottom, that you start with the number lowest, right? Waiting in line at the supermarket or whatever. That's a 45. But everything else on the list maybe is an 80. You start with the 45. That's how you don't get flooded. You do the lowest item and you do it until your anxiety comes down to like a 30. Then you go to the next one. Your anxiety is going to go back up. And then after a few days, hopefully, or a few weeks, that's going to come down.
Yeah.
And then you go to the next item. Yes, and eventually you're going to get to, I got on a plane and I was able to like go visit a friend or something like that. And if you use the hierarchy, you're going to go up the hierarchy slowly. You're still going to get really anxious, but that's the best way to manage what you're saying. You don't want to be at 100 every moment of your life, except in the beginning when you first start getting panic attacks. You're always anxious, right? I mean, it's just terrible. You're just like not feeling great. So that's basically what research shows. Make the hierarchy, move up the hierarchy, and spend some time understanding why you're anxious in the first place. And some people, you can't skip that step.
And like with the hierarchy, you accomplish those smaller ones. You're like, wow, I could sit in the barbering chair or salon chair. And
Exactly.
20 yesterday, or 100 yesterday. Now it's a 20, and that builds the confidence. Like, this thing isn't real.
Yes.
I can beat it.
Exactly, Joey. And we call that self-efficacy. I can actually do this. I was able to do it. Good for me. I tolerated it. I felt lousy, but I got through it. But keep in mind, when you approach any item on the hierarchy, initially your anxiety is going to go through the roof, right? You go to the barber the first time and you haven't been there in like a year, you're going to be like, whoa, like this is, I'm dizzy, I can't breathe. And you need it to go a few times before the anxiety goes up, and then your numbers start coming down. Like I keep a log. So if I'm starting out at a 95, each time you go to the barber, then you go, what was the worst today? Well, maybe it was still a 95. Well, what about the next time? Maybe it was like an 80. Well, that's a decrease. Eventually, you want to bring it down to 30 or 35 before you go to the next item.
So, Lori, I'm not anxious about pretty much anything, but when I'm on a plane and there's like some turbulence, I go bananas. My wife sees me and I'm just like freaking out. And I'm like, I would sit there and I'll go, if we go down, we go down. And I still I'll be watching a movie and I don't even care about the movie anymore. I'm focused on the turbulence and I don't know how to beat it. I'm like, I'm great at everything, but this stupid plane ride is getting the best of me all the time.
Yeah, well, that's a common fear. And when people feel the turbulence, they get monofocused and they can't use their strategies. Like they're trying to watch a movie, they're on their iPad or they're playing war game, whatever, and you can't concentrate. So, there actually are some courses at airports, like in New York at JFK, they have a fear of flying course where you go to the airport and you sit there and they take you through like, all right, so you take off, you hear that sound, like the wheels are like, coming up, and it's like you think the plane's going to explode, but it's really just the wheels. Like, so they teach you to understand what's going on with the plane, so you understand like this is what's happening. Turbulence is really just this. You actually learn about what it's about because it's unknown. The main thing about flying is it's the ultimate situation where you're not driving the boat. Literally, you're not driving the plane, right? So you're reliant upon someone else for your life. That's what it feels like.
Yeah.
And so that's a piece that you can work on in therapy. That's a different kind of work. Like what is it like when I put my life in someone else's hands? What is it like when I'm not literally deciding everything and driving the boat? That's when you might want to do like a little therapy into understanding what that's about. A lot of people just pop a Xanax and get on the plane, or they have like a drink or whatever, and they don't fly that often. So it's like, all right, once in a while. But if you fly a lot, you need to deal with, why is this even kicking up in the first place?
I think for me, it's controlling. Like if I'm going out with friends, I got to be the one driving because I don't know how they drive.
So there it is.
Yeah, so I like to be in control. I'm like, I don't know you guys. You guys can like take me in the wrong direction. Like I want to run the show,
Right. So there you go. So that's something that you kind of want to work on. Trust issues of being in control. And you don't really see the pilot anyway. Like they get on the PA, it's like, blah, blah, blah. And you're like, who is this person?
I
Like,
wish I would meet him, right? Like get to know him, what's his favorite food. Like, come on.
like then you may not really want to get on the plane.
Yeah.
But yeah, so it's often a control thing, and what happens when you relinquish control in your life. And that's the case for a lot of people who are anxious, by the way. A lot of people have panic attacks. That's another thing you asked earlier. What are the common elements? Need to be in control. But why? Why do you need to be in control all the time? We can't all be in control of life, like as much as we want to be. Like stuff happens. So
Mom is a super control freak, so maybe that's a little genetical.
And learned behavior.
Yes.
Probably you witnessed that, and so you took that in. Yes.
Yeah.
So that's right. It's always, everybody's like a jigsaw puzzle. Why they're anxious, when they get anxious, what helps them, what doesn't help them.
Yeah. That's what makes it exciting too. It's like every person that walks into your office as new, you're like, what? It's like the universe.
Yeah.
What am I gonna expect? It's like going into the deep ocean.
It is. It is, Joey. It is a little bit like that. It is a little bit like a puzzle, and then it feels nice to be able to see people start out in one place and get to a different place in life. It's very rewarding. So it's definitely intriguing and intellectually stimulating, but emotionally it's just really nice to see people be able to do things in their life that they really want to and feel better about themselves.
Yeah.
And that's why I'm still doing it.
Yeah, that's good. And you got such peaceful energy too. It's amazing.
Well, it may appear that way.
Smoke and mirrors.
I've learned my strategies.
There you go.
I always practice.
And that could be you guys. That could be everyone watching this. Look at Lori. She went through it and look how happy and calm she looks.
I practice it all the time, and I have a lot of humility about it. I'm like, well, I've recovered to a large degree, but I still struggle with it sometimes. And I always tell people, yeah, if I can do it, then anyone can do it. Because I was really, really anxious and really scared when I first started having panic. It was so frightening. I didn't know what was going on. So being able to even talk about this is nice. I always tell people, remember where you started. Think about your early days being anxious, right? Always remember where you started, because then people diminish their gains. Well, I should be doing better. I've only done this so far. Well, remember the day you walked into my office. Or remember the day that you first read about anxiety. How did you feel? You probably were completely consumed, not able to function, feeling really horrible, not sleeping, really just in bad shape. If you remember that, you can kind of self-reinforce yourself. And that's so important, kind of like, coaching and cheerleading yourself all along the way. And I still do that. Instead of trying to get self-critical, I'm not perfect about it by no means, but I try to remember where I started. And I keep learning and reading, and yes, be a consumer of information, but don't Google everything on the universe about anxiety, because there are good sources like anything else and not so great sources. And if you want to find something that confirms your worst fears about something, you're going to find it on Google. Yeah. So just do it again, like social media, do it sparingly, but keep learning.
Yeah.
You have time?
Yeah, you're awesome, Dr. Lori. Thank you so much. You're great energy. It's a good vibe on all three of us. It was really nice.
Anytime you want to talk, just we can
have another episode then.
Yeah, we can talk about more or whatever.
Yeah. Sure. Last question, I think. Sure. So you said firstly we have to check the reason behind anxiety. And what do you think is the main one? Like, is it trauma or? And if it's trauma, what are the techniques to solve that besides just talking, like there
Yeah,
are other.
yeah. I think that the way I was trained is really to take a full history before I really treat anyone. And that includes asking about trauma. Have you ever had a traumatic event happen to you, an accident, a fire, military, natural disaster, whatever it is, abuse, assault? Identifying that someone has trauma or PTSD lets you kind of come up with a treatment plan for them. Because with trauma, there's always a lot of anxiety, but there's also a lot of depression, there's a lot of numbness, and I think it's really important. You have to do exposure work. You don't have to, but it's recommended that you kind of work through traumatic memories, while similar to standard anxiety, the person has to go back to certain places to kind of confront the fears. It's not always possible. So, for example, if someone's in a natural disaster, they're like, I'm never going back. Like if they were in a fire, I'm not going back to that street ever again. And then that just keeps the anxiety alive. It's just like with panic disorder, you have to approach the fears again. Sometimes you do it in therapy where you review the memories in the safety of the therapist office. They do combat exposure now where they put headsets on and people can watch the battlefield and they relive their anxiety. It's very effective. So with trauma, there are a lot of really well-researched ways to deal with the memories. Also somatic work, like trauma resides in the body. People get headaches, people can't sleep, people have back problems, like whatever it is. So with trauma, taking a full history is so important, I think, in recovery for any mental health issue. So with anxiety, similarly, understanding the person's history, like you have to take a history. Like what happened early on? What kind of messages did you take in about yourself? What, was there family tumult? Who was in the picture, right? Were there things that happened at school? Did you have health issues? Did someone die early? Like whatever it is, those are all going into the mix to explore and to talk about. Because what happens is when you don't deal with these things, then that's when you hit the wall, like a little later in life, right? You start to get anxious or depressed, or people engage in compulsive behavior, whatever it is, or people start using substances. They haven't dealt with these very early issues. So I think that getting to a professional who can help you take a history and understand why you're experiencing these symptoms, and then helping you to come up with a plan to then deal with them. I think it's really, really important, and it's going to be different for every person. So that's where sometimes books, like there are so many books on anxiety and PTSD, and I'm all for reading. And there are some really good workbooks that you could do by yourself, but you need to understand, what is this really all about? Why do you need it to be in control? Why are you feeling out of control right now? What messages did you get from your trauma? That you can't trust anyone, or that the world isn't safe, right? Those are all going to contribute to symptoms, panic attacks, or feeling shut down or disconnected. So understanding your family story and your personal story, like what is your story? What's it really about? Will also help you in terms of your recovery. And I did that too for myself, really understanding where this is even coming from.
What helped me a lot was this website called CBT, Cognitive Behavioral Therapy 4, the number 4, panic.org. And it's a gentleman that got extreme panic attacks, and he breaks down, okay, if I have jelly legs, what does that represent? He goes back to the caveman times.
Oh, that's interesting.
Yeah, and how our body still remembers. We still have a little bit of the caveman mentality where we got to protect ourselves in the cave. We got to kill the big tiger dinosaur. Yeah. And if we got jelly legs, that means that the body is getting you ready to run. When you have palpitations, it means that your heart is pumping blood through all the extremities to get you to escape.
Yes.
When I saw that, like I healed like leaps and bounds. It was like, oh,
Yeah.
I'm not worried about my breathing. I'm not worried about my eyes going like peripheral, my vision. Like it all, he explains, he breaks down everything
Yes.
you can possibly get on a panic attack, and he explains it back into a caveman mentality that we still have, and what it means now. It means that your body thinks that there's danger. And
It's a threat.
all these motions that get you ready to escape.
Yeah, people say, why do I, when I get anxious, why do my hands get so cold all of a sudden, my hands and my feet, or why do they get numbness and tingling or whatever? Yeah, it's like the blood is leaving the extremities to go to the heart so that you can run off into battle.
Yeah.
There are some people who believe, I remember there were 2 books someone wrote, I don't remember what they're called, and they basically talked about how during a period of time in history, those people who were more anxious actually survived better because they were always prepared. Like if a dinosaur or whatever was like chasing, these people were always on alert.
Yeah.
So 2 people like hypothesize that these people, these families like survived, and that gene is kind of still running through them, and that it's anxiety is an adaptive thing, right? So hearing what you're talking about, which is really taking the literal symptoms and then linking them to past behaviors and physiological reactions. People say, why do my eyes get blurry? Right? Yes, because we need to be hyper alert with our vision and, be totally forward focused. So it's really amazing what the body actually does to keep us to enable us to survive. It's just in our modern times, we don't need these things.
Don't need it,
off. So just wired. It's just some of it's just hard.
Yeah.
And you can't break some of that. And some people are just more hard wired. That's what they blame themselves. I'm like, part of this is biology. Anxiety runs in families. Like this isn't all your fault.
Yeah.
And
that I watch those shows on people on Alaska, and young gentleman, he goes into the cabin and he's like, I feel like the way my ancestors felt, like pure, like he's hunting, he's bringing food, he's shaving it down, he's eating it, he's storing some, and it's just him by himself in a cabin, and he feels very attached to his past, like what we all have inside, but we never use it.
Yeah, because we live in modern.
We live a posh life.
I think that's why the other thing that's interesting is like when people are like Navy SEALs, right, or in their special forces in the military, why those people don't get anxious. They have such a high threshold biologically, right, for fear, right? Have you ever seen that? People can jump out of a helicopter and then like be in a submarine, and how they prepare them and they train them to see who actually can do this. It's such a rare person though who can withstand that kind of fear and not freak out, right? It's just like, again, that's a lot of it's biology. Those people they can handle a lot of fear and stress. I find that amazing.
Yeah. And during the training, they do a lot of exposure therapy. They put you in water. They let you sit in there for 30-degree water and see how you survive. And
a lot of people don't last very long.
Yeah. And then the ones that do, that's the interesting part. Like I like to interview those people and say, where were you? Like David Goggins. I don't know if you know David Goggins.
Yes.
Like the mindset, like why are you different from everybody else? Why did they quit and you didn't quit? Really interesting.
It's pretty amazing. So there is a big biological component. Yeah.
Yeah, the mindset is the big one, I think. Because even you said like you interpret this situation as an exposure, and someone else can interpret it like a bad situation.
Yeah, I'm gonna die.
Yes.
Scary.
And you just interpret it like it's an exposure, and you are even happy about it. And
right.
I'm happy.
That's why perception is everything, because when people get into an anxiety loop, they begin to kind of misinterpret what's happening. Everything feels like a threat. Going to the store feels like a threat. Going out the front door feels like a threat. Every sound feels like a threat. It's a misinterpretation. Yeah, so you're right. There's a lot of it is about how you perceive particular moments, and and a lot of retraining your thoughts.
Yeah. Even about social anxiety, I just noticed like I had that a lot in the past.
Yeah.
And the mindset behind it was like, I'm in a competition. Everyone is against me. I want to look perfect. And it's just puts on the person so much pressure. So
Yeah.
if you change your mindset, like we are together, it's just fun. Everyone just wants to have some fun. Then it just releases the pressure.
Yeah, I think I don't know if you had posted something about that. People perceive other people
Yes.
as judging them or the enemy or whatever versus, yeah, I'm going to a party, I'm gonna try to have a good time, and maybe I won't get along with everyone, but versus people are a threat. People can judge me harshly, you know, that can make me feel bad, they can hurt me or whatever. Yeah, there's a lot of, that's why in cognitive therapy, it's a lot of looking at these thought patterns and saying, is that real? Is that really happening? Or that's your interpretation? And how can we reframe that so everything doesn't feel so emotionally threatening to you? So that's what therapy actually can be really, really helpful.
Mm-hmm. I think Joey said, like, through what glasses you are seeing the world.
Yes.
And you have to change your glasses, like the mindset.
Yes. Yeah, we all have different filters. And the filters are not always right. They're not always, sometimes they are, but they're not always right.
But you know, it's interesting. Like when I used to do my therapy, I did 9 years of regular therapy one-on-one, and did 3 years of group. And you know, when I would finally heal something huge, I would walk out of the office and then be like, "Whoa!" I'm like, I don't know this personality. I don't know this feeling. This is not me. Because the therapist would heal a sensation. And then I learned, I had those a few times, I learned to just stay with this new feeling. But it was just so interesting to me, like when you start to heal this big pattern that you existed, you changing your glasses, you're putting on a new pair, and now you have to adjust with the new lens and see with those now. It's the same thing. You heal a huge part of who you are. Like, let's say you heal all your anxiety, and then you're like, wow, normally I would be anxious right now. Like, like, and it happens so quick, you know, it just, you get rid of it. And now you have to live like this new life, you know, with these new pair of glasses, you know.
There is an adjust. I mean, you're mentioning something that is not commonly talked about, but there is that adjustment period of seeing things with a new lens. I've even had patients be like, I miss my old self. Like they're just used to things being a certain way, feeling a certain way, and then it's so unfamiliar. It's like they feel different. They're like, I feel different.
I feel bored. I don't have anxiety.
We don't have it. And it's like, there's always a resistance in therapy. Like when you start to slowly, like, you're not pulling it away, but you're trying to like ease it away. You have to replace it with something new. Like, who are you now without your anxiety? It's a companion. Who are you without your symptoms? So it's interesting that you brought that up, because it is, people can be like who am I now? What happened? Like, and it can feel wonderful 1 minute, and then like, well, wait a minute, I'm just so used to this. Like, I don't know what to do with this. What do I do? I have extra brain space now to think about other things, you know.
Like the patient you have for 30 years with anxiety, like, have you helped that person along, and have they seen a lot of change? And was that the reason why they were afraid? Like, they don't know who they're going to be without this anxiety because it's been so long?
Yeah. Well, that's a question, you know. I've asked myself this question, and I don't know if you guys have asked yourself, like, I've asked myself, like, who am I without my anxiety? What would my life be like without anxiety? Because being anxious also has had upsides for me. Like, am I really more empathic because I'm anxious, or I'm just an empathic person? You know what I mean? But like, I feel like anxieties help. Like, a lot of patients will say, like, I want to get rid of my anxiety. But then when they start to decrease their anxiety, they go, I don't know if I'm going to be motivated anymore. What if I don't like achieve anything anymore? What if all these goals I have for my life don't happen anymore? What if I get really lazy and don't want to leave the house and I want to watch TV all day? You know, and they hold on to anxiety as having value in their life. So then when it's gone, it's like, how do I get motivated? How do I do things? How do I push myself? So you have to be mindful of that. And I always ask people, what do you think your life would be like without this anxiety? And it always comes up, almost always.
Wow.
Well, I guess I would feel a lot better, but then what if I don't achieve anymore? What if I don't get out of the house? So it's very interesting question to ask because people don't often think about that. They're like, I just want to feel better. Just make me feel better.
Yeah.
Even the self-compassion
Yeah,
side.
from parallel. Yeah.
Even the self-compassion side is like to be more self-compassion. Okay, but what if I don't push myself that hard?
Yes. Yeah.
So,
like, what does it mean to let yourself off the hook, to be compassionate? It just means you're nicer to yourself. It doesn't mean you don't tell yourself, I need to go do my laundry, or, I want to, I need to make a reel for Instagram or something today. I mean, you can, right. The anxiety, it's sort of a false value. And the self-compassion, again, I agree with you. It's sort of like people say, well, if I'm too self-compassionate, I'm going to let myself off the hook. Does that mean I'm going to excuse myself for the mistakes I make? Well, then what if I keep making mistakes? And what if? So,
yeah, I've been there. Yeah.
Tough one.
And maybe you will be, for a time, you will be procrastinating.
Maybe, yeah, for a while.
But at least you know the balance afterwards, like you know where to go.
Yes. And, the fact of the matter is that when we need a certain level of anxiety to function well. So studies show we need a mild to moderate amount of anxiety to function well in life and to meet our goals. Then we get into the high level. There's actually a chart about this. We get into the high level of a lot of anxiety, then it's diminishing returns. We're just like flooded with anxiety and we can't function as well. So we do need a certain amount of anxiety.
You just helped me with that one, because again, it went back to my control, and I don't like when I have any anxiety. I want to remove it completely. And the fact that you said that gave me this like wave inside me, like
it's true. But Joey, it's actually really true. We need a certain amount of anxiety. It's fuel. We need some fuel.
Even just labeling that differently, like instead of labeling that as anxiety or fear, you just label it like excitement, something good.
Yeah.
Can have.
Energy. Yeah, it's excitement, energy.
It's the same feeling, but you labeling differently.
You're right. We just mislabel it as that feels bad versus, oh yeah, I'm excited to do this task. I'm learning something new. I'm going to go to the gym and work out like a fiend today. I'm going to try something new. That's exciting. The physiological reactions are the same. Your heart might start racing. You're excited. But then we label that sometimes as that's dangerous. That's big.
Yeah, I used to be a stage actor, and before I got on the scene, obviously with stage acting, you can't make a mistake. I used to always have a lot of anxiety, but when I hit it out of the ballpark, the rejoicing feeling after the anxiety is the best part. So if you didn't have the anxiety, you wouldn't have such a rejoicing feeling, That's
true. And that really is true. If you feel flat all the time or nothing, right, you don't get the high highs. So
yeah. That's the other thing. I wanted to create a video about that. Like the bigger the challenge, the bigger the reward.
Yeah, I think that's true. Absolutely. Yeah.
It was very good. So how can our listeners connect with you? Like Instagram, I know you have a website as well.
Yeah. So I have my my Instagram is at Dr. Lori Davis, DrLoriDavis, and I have a website, drloridavis.com, and it has all the information on there. So if anyone has any questions or needs help, you can just email me or contact me on Instagram.
Awesome.
Okay. Is there anything you would add, something or last thoughts?
Yeah. Anxiety is treatable, and you need to read and learn and absorb. You need to reach out for help. That could be therapy. It could be through something spiritual or religious. And you need to believe in your recovery. Self-belief, again, is one of the most important things. It may feel terrible, but if you approach it a little bit at a time, you can find yourself in a different place. So I highly encourage anyone out there who is experiencing panic attacks or social anxiety or agoraphobia or OCD or generalized anxiety or a lot of worry to read, learn, reach out for help. You can find help through in the States through the anxiety, the ADAA. It's Anxiety, Depression, and Anxiety of America. Sorry, the ADAA. You can find them on Instagram. There are a number of organizations for anxiety around the world that you can Google, and they'll give you referrals for therapy in your area. For trauma, the ISTSS, that's the International Society for Traumatic Stress Studies, also has a directory of therapists around the world if you want to get connected with help. Finances are an issue. There are lower fee clinics through hospitals. There are even research studies that actually are really well funded where you can get help for both anxiety and PTSD. The key is to reach out, to be honest about your symptoms, and know that you can recover. Not always be cured, but you can recover and you can manage it.
Mhm.
I did it. You can do it too.
Yeah, we all three of
We're
us
all
did.
in here, and here we are talking about what works, what doesn't work, directions for the future.
Yeah.
We're all here.
We're a prime example.
Yes.
Yeah.
Anyway,
Okay,
thanks.
All right, guys. All right, Lori, thank you so much for coming. We appreciate having you.
Yeah, thank you very much sharing with us your knowledge. Thank you.
Take care.
Have a nice day. Bye bye.
Hey.